Hi there. Welcome to Thrive to Learn. I'm your host, Deanna Bruce, advocate for thriving students. I work with K12 schools, government, and nonprofits at the intersection of health and education equity. I advise, consult, and train to help leaders and their communities pair empathy with policy to implement student centered and human centered solutions. I started this vlog to invite others to the conversation. I love talking to people, hearing their stories and learning from them. And I want everyone to feel empowered to join the conversation to advance empathy and policy so all young people can thrive to learn. I'm so excited today to welcome my friend Aria Montcrieff, Director of Operations at DC Prep Public Charter School here in Washington, DC. Welcome, Aria.
Thank you so much for having me.
Yeah, sure. Let's go ahead and get started off. I'd love to learn a little bit about you. So give me your 30-second
Mhm.
elevator speech about who Aria is, what you
Sure.
do, and how you got here.
I like to joke that I accidented into my career. I totally thought I became a high school teacher about 10, 11 years ago. And I was a high school teacher for 8 years at a public school in the Bronx, teaching government and economics. And somewhere along the way, I told my principal, hey, I'm good with spreadsheets. I can help crunch some of the data. And my career was born. COVID kind of recalibrated my priorities a bit, moved down to DC, and was hired at DC Prep to originally be a COVID recovery fellow through a program with Ed Pioneers. And so I jumped in, I used all that data aggregation and visualization and simplification work to try and help clean up the systems that we were using to implement COVID policies and protocols. And that's when I kind of got the passion for, that's when I really sort of got the look behind the curtain of, oh, wow, this is a huge part of education, student health, not just um, education, academic health, learning those skills, which are massively important, but food, wellness, nutrition, mental health, and medical health as well. And I sort of got this real passion as I started looking, oh man, you know, so many of the families that I work with don't have access to this. So many of the families don't have a resource for this. There's no access to this. And so at DC Prep, part of my, as COVID was wrapping up, or at least the urgency of it was wrapping up, I naturally found my way to immunization policy and processes, and I've been helping that at my job ever since.
Wow, that's quite a trajectory. But that sounds like almost everyone, right? Where our life is not a
Yeah,
straight line. It's a twists and turns, and then you're like, oh,
yeah,
here's my passion. Here's my passion. Uh,
yeah,
That's super exciting
yeah,
to hear that. And I'm so grateful that your passion and your path led you to DC Prep
yeah,
and to this work. During the COVID-19 pandemic, we
mhm,
all know that routine childhood immunizations went way down.
yeah,
Families avoided the leaving the house, going to the doctor, things like that. And pretty much every public health professional in the whole country and around the world was focused on COVID-19
yeah.
and not necessarily focused on a bunch of the other health issues that were affecting young people, like staying up to date on immunizations.
Right.
This put children at risk of dangerous illnesses. It put school communities at risks for outbreaks of vaccine preventable diseases, and it put unvaccinated students at risk of multi-week quarantine periods away from school if exposed to a
Yeah,
vaccine preventable illness.
yeah,
And so we know this past year, schools across the country did this, but in particular in DC, there was a huge push to get students up to date on required childhood immunization. So in DC, you enroll in school and then you have a period of time to turn in your immunizations. And so schools prioritized four grades: pre-K 3, kindergarten, grade 7, and grade 11, and excluded these students from school in early December if they were not fully immunized by then. It was quite the undertaking, and as a consultant who worked directly with all of DC's public charter schools to help you all implement this requirement, I was personally blown away by the success that schools like DC Prep experienced in getting families focused on this requirement and ensuring that their kids were fully immunized by that December deadline. Um, And it meant really that the schools that put in that hard work in the fall, engaging families, didn't really have many students that even needed to be excluded. And so, Aria, I felt like you and I were on the phone like literally all the time. I mean, I felt like that because like
Yes.
literally we were on the phone all the time.
Yes.
But for our audience who was not a party to our phone conversations, can you please share what you did to make DC Prep so successful at managing the data, engaging your families, and getting your students fully immunized by December?
Absolutely. I I mean, honestly, I feel like I had a bit of an advantage coming from the data-based background. Started from the point of like, okay, there's a lot of information here. Before I go anywhere and I make any sort of system to try and track this and act on it, my first question was, all right, what's the goal? Is the goal, because you have so much information, people assume that it's obvious. And it's not. Like I could send that spreadsheet to people and they'd be like, okay, great. What does this mean?
Mm-hmm.
So really, what's the goal? And that sort of led okay, the goal is to get our students immunized, period. So what do we need to do and work backward from there? And the second, also very important question is who is actually at my schools using this information, right? Like who is really going to be the ones other than me looking at this information and acting on it? And so, as the data person breaking this down, I needed to make sure the resource I was building and the ways in which we were asking families to interact with it and our staff to interact with it made sense for the audience. Because I could make a spreadsheet that was really beautiful and pretty and all sorts of colors and flags and hey, these kids need this. But if it wasn't usable and helpful to the people who were actually on the ground calling families, then I was spinning my wheels.
Mm-hmm. Well, and it sounds like, even though DC has an immunization registry, you are taking that information and
Mhm.
then creating your own
Yeah.
database slash spreadsheet to help drive the work of the team that you pull together in the building
Yeah.
to act on the data. So
Yes.
you were so first I wrote down some notes. Like first you have to get a spreadsheet nerd or a data nerd or find someone in your building to
Yeah.
serve as that nerd that is
Yes.
translating the statewide immunization data
Correct.
into data or a spreadsheet so then the second thing is you have to have a team that's going to act on the data.
Yeah.
And then I also wrote down that you need to have a goal that's clear and you need to
Hmm.
communicate that goal. So you were
Yeah.
communicating that goal internally with your team, and then they were externally communicating that to
Correct.
families. And then the fourth thing I heard was like, don't change the rules on
Yeah.
families. So
Yes.
what I experience is families really rely on a deadline.
Yeah.
And when the deadline keeps moving, it breaks down trust and it makes it
Yes.
hard for families to prioritize it.
Yeah. And we
Um,
saw that. I think one of the things I wanted to point out too is like, this is, as you're building these systems to tackle these challenges, you have to realize it's going to be messy and it's a trial and error process, right? This thing that you thought, I definitely went through this. I thought this spreadsheet was super clear. I put it in front of people and they'd be like, Aria, I don't know what you want here. Like, and you have to be open to that feedback because the way my
yeah.
brain works is not the way everyone's brain works. And as someone that is so data focused and data driven, the
Hmm.
narrative element, the like, and also coming from a place of support and not mandate. Like that's a big thing is families, if they're going to get a constant phone call of like, did you get your kid immunized? Did you get your kid immunized? They're just going to stop answering the phone. So there are so many different supports and ways of speaking to families about this that come from a place of, hey, we are here to support you and help you in this.
Hmm.
We don't want your child to get kicked out of school. We don't want your child to get sick. So, how can we support you in that instead of a phone call that says, you're in trouble if you don't do this and your kid's going to be
Right.
punished? Right. And I
So
think
how did
that's
you
a
do that?
so I mean, the first year, I'm going to be honest, we didn't do such a great job because it felt so urgent and so. Um, a lot of the mandate coming down was no excuses, no way. Everybody has to be up to date, and the schools were like, well, like half of our kids are not. I don't know how it's going to
Right.
happen. So it kind of came from a place of panic, which then trickled down to the front, to me, to the front desk staff, and then to families. So the second year, I think, was way more successful. We took a
And that's
lot
when
of what
they
we learned.
prioritize the 4 grades?
Yes, when they prioritized the 4 grades, and we started the process earlier. Um, and we had much more of a runway, it felt like. Because the previous year, day one of school was your 20-day warning. Whereas
Mhm.
this year, they were much, the, the Office of the Superintendent and the Department of Health were much more in line with how schools actually function and operate. Our rosters aren't done until the first week of October, right? And
Right.
so they listened and responded and said, okay, these 4 grades, because these 4 grades are such crucial vaccines at a crucial time. And also we're going to give you more runway and not start the 20-day clock until after your rosters are locked, which was very, very helpful. It was much more understanding of how schools function and operate, which helped it be more successful.
Mhm.
And the second thing is we learned, I'm going to be honest, letters in the mail and emails didn't work for us. So for us, what we learned was really not only changing the language and giving my front office teams scripts on how to answer questions and deal with some of the like fear that comes up with these things. Like parents are like, I don't want to do that to my I don't want to do that to my kid. How do we empower those that are making the phone calls to be understanding while also holding people accountable? So the
Mhm.
scripting of that was a real big thing. And then the second part was realizing to give very clear point people like this is your role, and kind of encourage them to not just call, like yes, call, but when you see that parent in the hallway dropping off their kid, when you see that parent outside, hey, Mr. Smith, so glad you're here. I just wanted to follow up. Is there anything else we can do? That was the most effective thing. So the phone calls, yes, but the in person, because then when you see a person's face and you're reaching out
Yeah.
person to person, and a lot of times parent to parent, a lot of most of our front desk staff have kids of their own. And so to be able to talk parent to parent about this was you personalize it. You don't make it so
Right.
much about the government mandating this. You make it
Mhm.
about we are concerned for your family and your child's health, and we want to make sure that we are holding you accountable while also not just doing it and then walking away.
So thinking about now for this coming school year, like what successes have you already had in sort of your planning for the next school year, and what steps are you going to take over the next few months to make sure that you can replicate the success you had last year?
I will tell you. So one of the things I did in, I think it was March of last year. So when, exclusion season, essentially December is when exclusion day hits, but then you're doing a lot of diligence and follow up in January and February.
Mhm.
So around March, I sat down with my front desk teams and I did a feedback session tour. I have 6 schools. And I said, tell me what worked. Tell me what didn't work. Tell me your success stories. Tell me your struggles. And so I took all of that feedback and I sort of recalibrated a few things. One was having one front desk person, because we have 2 at each of our front desks, having one person be the immunization person.
Mhm.
Because so many times in the chaos, this person said something, that message
Yeah.
didn't get relayed. This person said, the principal said
Yeah.
something that wasn't. So we have now designated a campus level immunization person who is that designated person on campus. Having myself be sort of the data gatekeeper has really helped as well. So I've created a system where I have one person at the campus who sends me the records. I review them. If our school nurse or our school health tech can assist, that'd be great. But a lot of our success has come in alleviating or partnering with our school nurse instead of putting
Mhm.
it all on their shoulders. The other thing that was really important was to make sure we don't just think of December 4th as the only time of year we're talking about immunizations, right? Is that I remember talking to some of the leaders, they're like, why are we talking about immunizations in May? That we have to deal with this in the fall. And getting my team to think about immunization compliance is a year round process, not just October to December. Um, that will help reduce our non-compliant numbers, and I've already seen that success. Like I just went and updated the immunization data this week for next year to get us ready, and my most successful elementary school right now granted, we're missing our pre-K3 data, so I can't get my hopes up. But right now we only have about 10 kids that are not compliant, which is amazing.
That's awesome.
It's amazing. It's
Yeah.
unbelievable.
Yeah.
And, and just for reference, last year at this time we had 35-ish,
Hmm.
so just getting this to be a part of the conversation our staff is
Hmm.
having in the same way that they have conversations with students who are MKV, right? There's a
Yeah.
year round process for interacting with those families and making sure they have the resources they need. So
And for everybody out there,
oh
what is
yes,
MKV?
MKV is the McKinney-Vento regulations that ensure that students who are in temporary housing get access to additional resources and additional supports throughout the school year to make sure that kids can continue to come to school safely and regularly.
Hmm.
And so part of the operations team is that we make sure that those families have access to that and are entering those conversations about those resources frequently.
Yeah.
Same goes now for immunizations. Is I'm now implementing monthly updates with my designated campus point person to look at the data together and be like, here's our target 10 for this month. Here's our target 20 for this month.
But as we close out, I'm wondering what advice
Mm.
you have for other school leaders who are also working to bring all of their students up to date on their immunizations.
Oof, what advice so much. I think I think the most important thing is to lead with kindness to your families. Um, I think it's really easy to get frustrated with families because you can get like, just bring in the paperwork. Why haven't you brought in the paperwork? Just bring us the shot. Just get yourself. So you kind of get frustrated because
Hmm.
schools get so much pressure about compliance from government entities, right? And so that frustration tends to trickle down. And so I think the number one thing I would say is remember why we're doing this, right? And as you're speaking to families or as you're writing a script for your teammates to talk to families, your front desk staff, your operations staff, whoever it might be, your health, school, suite, nurse, make sure you're bringing that energy to them so that
Hmm.
because I think when we're frustrated, they get frustrated and that energy
Yeah.
perpetuates.
Yeah.
It's like a classroom. If you bring in frustrated energy, you're going to get frustrated energy back. But what I also think is important is that we celebrate the successes, right? And that we allow for this to be a bit messy as we grow.
Hmm.
Find those people in your school that really care about this stuff. Don't just make it a nurse issue. Your nurse should be your support, your main point of contact for a lot of things medical, but don't just put it all on them. Share this, I don't want to say burden, that's not the right word, but share this initiative with others in your team.
Hmm.
Families really respond to conversations with people they know. And listen, your front desk staff is who our families see almost every single day.
Hmm. Right. And when you approach families in that kind way, we can be more amenable to the
Yeah.
education,
Yes. Yes.
more interested in what you're trying to actually communicate to us, so that we can take the action you need us to do.
Yeah. If they feel like you're their advocate,
Hmm.
they will be much more willing to lean in and listen. 100%.
Right. Well, this has been great, Aria. Thank you so much for coming on Thrive to Learn today and chatting with me. We are done, and we're going to link your information in the show
Sure.
notes for anyone that has follow up questions.
Absolutely. I am super happy to go on data nerd deep dives with anybody that has questions.
Awesome.
And I appreciate you having me today, really. Thank
Yeah.
you.
Yeah, it's been an honor. Thanks so much for being
Thank you.
here. So, wow, this is a huge topic, and we have so much follow up to do. Each of us in schools across the country, childhood immunizations are so important for the health and safety of our students. And getting caught up is essential to avoid academic and operational disruptions during the school year. I want to hear what resonated with you. What parts of this discussion do you have more questions about? Let's continue the conversation and please reach out to me. I'd love to jump on a call and chat about how we can work together to create an environment in your school community where all students can thrive to learn. See you next time.